But I am a fucking queen in my field. Bro, I can't help it. I'm a funny bitch.
We're funny people. We don't even try. Like, what do you mean?
Does it like convincing, oh, you should do that, you should. No, you shouldn't. One day, I promise you guys, I am going to make her sing for you. As a nurse who respects her job title.
Yeah.
Because these women dominate.
Yes, women do dominate, which is very
questionable. Hi guys, I'm Biba.
And I'm Heidi.
And we are
Aesthetically Sisters.
Welcome back.
Amen. Happy Wednesday.
Yes. Episode 2. Let's roll.
Let's get straight into it because I'm pretty pressed. Now, by the time this goes out, it's probably going to be a week old, but the Australian TGA just released some intense guidelines for the cosmetic medical industry for non-surgical procedures. And I'm pressed because it's something that does affect us and does have an impact on our business, unfortunately.
Absolutely.
It's just sad.
It's pathetic, some of the things they've listed. Like, I can't deal.
So,
it's...
To fill you guys in if you're not aware.
Yes.
In Australia, nurses and doctors who perform these cosmetic medical treatments like inter-wrinkle fillers, etc., are guided by really strict guidelines by the TGA and APRA. Now, these regulations have just gotten more and more strict over the years.
Yes.
And last year probably was the strictest it's ever been, where we were restricted
in
from
2023 it happened.
Was it 2023? Yeah, September 2023, where they said you're not even allowed to say cosmetic injectables. You can't say that you even perform these treatments. You can't say that you're going to make someone look and feel better. Like, there was really strict regulations put out that
we weren't
really
even allowed to post before and afters.
Before and afters, not allowed to put emojis, like nothing, which became really difficult for businesses, especially new injectors. So I felt for like people who were new to the industry because there's no way of advertising yourself. Now they've even gotten more strict and more hardcore, and I'm so annoyed.
I know. It's really frustrating. In the beginning, in 2023, when they did come out.
I was very understanding.
I wasn't.
I was.
In the beginning, I wasn't. This is what I'm trying to say.
Yeah.
I wasn't in the beginning until I calmed the fuck down. And then I came to the realization. The reason they're doing this is the industry is growing so rapidly.
They're trying to control.
And they're trying to control what's going on social media and how these new injectors and not just new, but all the injectors, but there's just an uprise of like all these new injectors coming out of the woodworks, and everyone thinks they're a fucking specialist.
And
everyone thinks that they're senior, and they've been doing it for 5 fucking minutes.
And my new this, and people were editing photos.
Yes.
And I totally get it that
which
obviously
is misleading for the client.
The point is to obviously protect clients and patients and whatnot. Now, I totally get that, and that's why I was so understanding, because I was like, there is so much shit online that is so misleading, and
that's right.
It actually instills so much fear and anxiety towards procedures like this to people. But now it's out of control. So we're actually going to read you guys a couple of these new guidelines.
Okay, do you want to start? Do you want to read one and I'll read the other?
All right, these are some of the new guidelines that are triggering me, all right? Do not use terms that trivialize, such as doll maker, magic hands, sculptor, artist, god, king, queen, master, world's best, and world-renowned to refer to your work.
But I am a fucking queen in my field.
But we already can't say that I'm a cosmetic nurse. We already can't say that, not that anyone specializes, but like there are already so many things you can't even say. So what are we left to? Maybe make a list of things that we can say.
Well, exactly. They've made it really hard because in each dot point, they've given 100 examples.
Different examples of what you can't say.
Exactly. And
so at this point, I'm going to just delete the Instagram.
No, you want to?
I'm joking.
One that I found actually, I don't even know how that was like.
How did they sit down and decide?
And come up with them. Hold on, where is it? Here. No singing, no dancing, no comedy. Bro, I can't help it. I'm a funny bitch.
We're funny people. Like, what do you mean?
But what if I start just imagining I'm not funny and still post?
Yeah, I
That's what I
identify
mean.
as a non-funny person. So what do
Exactly.
you mean I can't post? It's ridiculous
It's becoming silly.
because we couldn't talk about what we do and show what we do. People started doing, videos and TikTok dances to, have their name come up.
Yeah.
And now we can't even do that. This one is really annoying me. You are liable for what influencers post. Actually, I'm actually happy about this because people thought they
we
found
did a whole
loophole.
episode on this.
Yeah, where they were getting like influencers and TikTok people to come to their businesses, and thank God, because let's be real, they're not paying for the treatment, and you're trying to get your name out there. So thank you for that.
Yeah,
I approve.
I approve of that one, definitely. No emotional reactions of patients. So when we do treatments and if they are being recorded and a client is like, oh my God, I love my lips. They look wonderful. We're not even allowed to do that.
Yeah. No testimonials.
No testimonials.
We aren't even allowed to reply to a Google review.
Yeah, that's actually in there and that's fucked.
That is wild.
Is
like
pathetic.
if someone is willingly trying to just say, I love this place and I trust, we can't say thank you. Like, so you're telling me I can't have manners?
Yeah.
I can't be respectful?
No, they want us to be just boring.
I'm not boring.
I know.
Do not prompt unrealistic images of youthful, ideal, or flawless bodies or shapes. Use phrases that imply well-being will suffer without high-risk cosmetic preachers, such as happier version of you or similar. So we can't tell people that this is going to make them feel better when we know it is.
I know, but in saying that, I also believe people were posting certain things, like in the industry, practitioners were posting, targeting people's weaknesses. And this is what the guidelines are trying to protect.
Yeah.
They want the consumer to not sort of, because this is the world we fucking live in now. Oh, this person's got so many followers. Or look at the photos, they're so bright. And like they're edited. Look how nice the skin looks in the lips of the before and after. Look at that. Look at this. And they don't want the consumer to be sucked in by these little, what are they called, hooks and whatever else. They want the consumer to be responsible.
Yeah.
Go and have multiple consultations. And then decide who's the right practitioner for them.
That I agree with.
But
the thing is, not a lot of people are going to think like that. And there are going to be so many clients and so many consumers and patients who are just going to fall for someone who's having a flash sale.
Yes.
And ends up
that's
botched.
what happened in 2023 when
there was an uproar of hyaluronidase injections because people were just out here getting botched cheap treatments.
Yeah, because everyone was putting their
I get that we can't post, but at the same time they've just opened up a whole new door for unregulated treatments to happen.
That's
like
right.
we spoke about a couple of episodes ago about those people who ended up in hospital.
Yeah.
If we were able to make educational videos about this, we would also be saving so much.
Yeah.
But then I get it because some people have no idea and are just yapping online.
I know. And it's misleading for the client.
Yeah.
And I think in the last year and a half, the amount of fucking misery that's gone on in people's faces, in clients' faces, because they've thought this injector knows what she's doing because she's called herself a senior nurse or a specialist or a fucking whatever they call themselves.
Educator.
Educator. The amount of people that think, oh, just because this person is a trainer. Honey, anyone can train.
Please.
But this is why we've got this platform.
Wait, there's a few more that I really gotta say.
Go say them.
Must not use automated apps, websites, tools, or programs that predict an individual's appearance post-procedure or predicts a person's appearance without a procedure being done. So, but this also applies to surgeons. So if do you know how like when you're doing a nose job, you can that is bizarre.
I know. So often clients do come and ask me,
Can you show me what I'm going to look like?
Show me what I'm going to look like. Can you take a photo of my face and sort of edit it? And firstly, I don't know how to fucking use those editing tools. So thank God for that. And secondly, I will never do that.
Yeah.
That's so unethical.
I think for like injectables, I'm like, how do you even do that? But for like cosmetic surgery, like a lot of people rely on that because you're actually going under the knife and most of the cosmetic procedures are not reversible. Yeah. So I think that's a little bit silly. There are a few more and then we can move on.
Yeah.
There are a few more then we can move on. Do not post too frequently and no emojis. What do you mean I'm not allowed to use? Emojis are a way of communication.
I know.
And I'm not allowed to use it in my captions now. And I'm not allowed to post too frequently.
I have whole conversations
what do
with
you
emojis.
mean? What do you mean I can't post too frequently? So I can't what is too frequent? Once a day, every second day, once a week.
And they're very vague.
Very vague.
Very vague. Like,
so they leave enough room for loopholes so they can just screw you later.
Yeah, screw you. Well, that's what they do. And then, because they're saying things as well, like about the websites, our personal business websites can't have all of this stuff included on there. So
it's like 5 pages of like new regulation. It's a lot.
It's a madness. But
I get it.
It's so fucking, it's such a double-edged sword. I also get it because nurses in our industry are losing their ethical practice.
Amen.
And they are not working for the love of the work, but for the money that they think they can make.
Amen.
And this is where the industry's gone to trash.
I have to agree with
like,
you.
yo, ruining it for all of us.
I have to agree. I feel like there has been such a big shift where people are literally just doing this job because they can, because it's an extra paycheck, rather than for the passion of aesthetics and the client or patient.
Absolutely.
And this is why our industry is so regulated and why there is so much negative output and insight on our industry.
I know. It's insane. The thing is, the amount of nurses jumping out of the woodwork and nothing triggers my soul more than when, and so easily makes me lose respect for a single individual, is when someone says to me, oh, I'm studying nursing I could get into injectables, but I hate nursing. I hate the hospital part. I just can't wait to start injecting. Shut the fuck up. Do not become a nurse if you do not appreciate what it is to be a nurse. What kind of nurse are you going to be to your clients if you're not appreciating your own fucking job title?
100%.
It's such a privilege to be a nurse, guys. Call me Biba Nightingale.
Being a nurse isn't just, about putting a needle to someone's face. It's about caring for someone in a time where they're vulnerable.
Absolutely.
Being ethical. Doing something for the other person's best 100%. Interest. It really comes down to like your morals as well.
Contraindications, if clients on medications, if they have autoimmune disease, if they've had, like, the amount of people that I've seen that tell me they'd gotten infections because they've had dental work and gone and got their lips done and it's created all these problems.
The thing is, it's not just about putting a needle to some of these. There is so much more to it.
So much more.
And this is why we're having so many complications, because people don't care. The nursing aspect of your job as a cosmetic nurse is so much more important than the cosmetic aspect of it.
Absolutely.
Because if you're having a patient that's going to have an anaphylactic response, an allergic reaction, start seizuring on the bed, it is your responsibility as a nurse. You have a duty of care. There are code of conduct and code of ethics that you need to follow to protect this person.
Absolutely.
But if you're not, qualified enough, and if you're not knowledgeable enough to know what to do, which is basically your basic practice, how to respond in time of emergency, then you shouldn't be doing these treatments.
Exactly, because how are you going to manage a situation if our whole aim in our industry should be delivering the safest practice.
100%.
In any form of nursing.
Yes.
And when they're not appreciating what you could learn on the wards, this is what they need to fucking change.
Yeah.
These nurses need to go and work at least 1 year on a ward, actually learn proper nursing skills, or have mentorship a year or two by a nurse, shadowing, learning consistently, not doing a 2-day course, that you've just found online and then calling yourself a cosmetic injector. All right, I can't fucking deal with this shit. It's become a joke. Because I'm very nursey, as you can tell. Okay, and the simple holding of the syringe is a fucking art form. And how do you master it to a face if you haven't mastered it to a body?
Amen.
And on the wards, that's what you learn.
Yeah.
Carrying a syringe, being comfortable with holding a syringe, being comfortable in actually approaching a face with a syringe.
Yeah.
When these clients are putting so much trust in you. I've seen nurses not even know how to deal with a client fainting.
And or client bleeding
And that can
stuff
happen.
like that. And don't forget, people are very vulnerable, and having a cosmetic procedure done is quite nerve-wracking.
It is.
To a normal patient,
Absolutely.
right? Who hasn't done it before or has a fear of needles.
Yeah.
So as a nurse, you need to know how to, have that patient-centered care where, all right, this person's nervous. We'll give them a little bit more TNC? Tender love and care. TLC. Give them a little bit more care. Make them feel more comfortable.
Yes.
It's little things like that you need the experience on the wards and dealing with unwell people, sick people, vulnerable people that will allow you to, get better at offering and giving that patient-centered care.
Absolutely.
And when you have someone who is fainting, I remember once, it was the first time I've had a client seizure.
Yeah.
And Bibba wasn't in clinic that day. But I was I was so proud of myself after that, because I was like, wow, I handled that like a pro.
She's trained by the best.
But I was so I had a patient having her first time treatment. She did say that when she's had a blood test before she had seizures, because she has a phobia of needles. So I was doing her lips and I noticed she's starting to go pale. These are things that as a nurse you should be picking up.
Exactly.
Started to go pale. I said, are you feeling right? She's like, no, I'm fine. I said, you look quite pale. Let's have a break. Had a break, and then she started feeling a bit dazzy and getting a bit clammy. Removed the pillow from behind her face, laid the bed back, legs up, gave her some water, and then she started seizuring. And her mum's screaming. I said, it's right, leave her, let her put air. You have to just let them be. I know how to, take control. Yeah. Anyways, we finished that, and then my patient and her mum were like, oh my God, you handled that so well. It was so calm. Last time this happened, the nurse freaked out, and I'm like, but this is because I know you have to have experience, and
Absolutely.
you need to know what to do in a time like that, because that person is under your care, not just to get their lips done, but if there was a complication to go wrong, you need to know how to fix it and what to do.
Oh yeah, girl, I know that.
And so many people don't.
No, I know that.
It freaks me out.
I fucking know that. These regulations are only going to keep getting worse, because there's more and more nurses just coming out of nowhere.
And doctors as well.
Doctors don't even fucking start me.
When some say, oh, I went to this doctor because he's a doctor. I'm like, yeah, but doctors literally only do cosmetic injectables.
Because they can.
Because they can, not because they're passionate about it.
That's right.
And it's not about just putting a needle to a face. It's about understanding aesthetics, cosmetics, and the art of
and
beauty.
Anatomy and managing. 90%
100%.
of our job is actually doing a mental health assessment on a client through your consultation. You need to be able to pick up cues.
Yeah.
Or, whatever you want to call them, those little red flags. If someone's coming in, how they're talking about themselves, or how they are explaining what is bothering them, their concerns, and why they want to do these things. It's all, you need to be able to subliminally do that.
Yeah.
Those assessments for these new nurses, it's not happening. And not only new, there are so many. I know nurses that have been injecting 10 years, and I would never trust them with a fucking syringe near my cat, let alone near my fucking face, right? And it's crazy, because the industry it's the love for the money that can be generated through aesthetics is blinding people.
Yeah.
When these injectors are saying to me, I went to uni to become a nurse because it's great money. I like the flexibility. What the actual fuck? Because your money that you can make today isn't going to be there tomorrow when you're that fucking trash at your job.
100%.
Okay? And it's going to cost you more when you're fucking trying to repair the damage you've done.
I think sometimes it's... I'm very picky. We're both very picky with our clientele.
Yes.
Not picky, but there are some people, I believe that when you're having, doing a cosmetic treatment is very intimate, very personalized.
100%.
And you need to have a genuine relationship with your patient as a practitioner and the patient with their practitioner. And there are some people that really just, you don't have the same vision. You aren't understanding each other. And there are times where you literally need to refuse treatment.
Yeah, absolutely. And that's what makes you a phenomenal nurse. When
you can
your
identify.
patient's actual outcome is your concern.
100%.
And dysmorphia is a real thing, guys.
Yeah.
Body dysmorphia is a real fucking thing. And sometimes people get so carried away. For example, I'll give you guys an example, the lip filler craze. people come in and they've got lips half the size of my face and they're like, we want more. And if I say, come on, let's start talking about balance, harmonizing your features. You're going to be all lips. And sometimes they'll be like, but why, I don't want to talk about that because my last nurse would just do it. I'm not your last nurse.
Yeah.
Okay. I care about you. I care about your appearance and keeping you aesthetic, not making you look ridiculous.
Yeah, 100%.
And there are nurses that will be like, yep, no worries, get on the bed. And they'll just do it because they're after the paycheck.
Yesterday, I had it was my last client of the day. And she came in, she had booked this appointment maybe 3-4 weeks ago. Our Thursday nights are very busy.
Yeah.
Anyways, so she came in and first time client, and we're having a consultation, and as soon as I see your face, I start assessing like what's happening, what do we need to work on. You know, I need to have my idea when you're telling me what you want. Anyways, she comes in for her lips, and I'm looking at her lips, and they were honestly, in the nicest way, one of the worstly migrated lips I had ever seen. The filler was literally like her whole lip was sitting like this.
Oh,
it
wow.
was protruding so badly, extremely overfilled, migrated on the upper lip and in like the inner lip. Like her wet dry border was filled, horribly migrated here. Her corners were so empty. Like the filler from her bottom lip was literally sitting in her mental crease.
Wow.
Really bad. And she's like, I just want to do a little bit in my lips. I said, really? And she's like, yeah, I just like my bottom lip is so much smaller. And I'm like, I put out the mirror and I'm like, look, volume wise, your lips have the top lip and the bottom lip are very equal in size. I said, but you just are extremely empty in the corners.
Yes.
I said, however, can you see that you're very migrated? And she's like, yeah, a little bit. I said, no. I said, your top lip is so migrated that the way it's sitting is just making your lips appear so much bigger than what they actually are. And she's like, yeah, but I don't want to dissolve them now. I said, okay. I said, so what do you want to do? She's like, I just want to do like 1/2 mil only in the bottom. And I'm like, we don't offer 1/2 mil. She's like, well, my other nurse does. I said, well, we don't. I said, and at the same time, like you should really be considering dissolving your lips.
Yes.
Went back and forth, and she's like, I don't understand why you just won't do 1/2 or 0.25. And I said, because 0.25 isn't enough, and 1/2 mil I don't offer, and 1/2 mil is not going to fix your lips.
Problem.
Had this conversation, we clearly weren't on the same page. I'm like to her, look, unfortunately, I'm not going to be able to do that for you.
Yes.
I don't think it is the best treatment for you, so it's not something that I'm going to do. And she's like, that's fine. I can find a nurse that's going to do it for me. And I'm like,
you saved her, but by doing that,
100%.
exactly. But this is where the culture of our industry has
be like, yeah, get on the bed. I'll make an extra $400. But like to me, I'm like,
it's not about the $400.
She's gonna walk out, and I think I wouldn't do something on someone that I wouldn't do on myself.
Yes.
Okay, I wouldn't want to have lips that are that badly migrated and have my professional practitioner tell me that that's okay and do it for me.
Yes.
Like, I don't want her walking out and people thinking that's a testament to my work.
Well, yeah.
And your lips are so badly migrated. We like the cap refill was horrible. So like,
wow.
I'm thinking safety as well.
Of course. But what people clients like herself, what they don't realize is they are a walking billboard advertisement
100%.
for our skill set, for our ethics, for our business, for our beliefs and what we offer.
Yeah.
And when we are refusing certain treatments, we don't like you. It's not personal.
It's not a personal thing at all.
It's never a personal thing. It's we have your best interest at heart.
Yeah.
And as a nurse who respects her job title, it is our responsibility and we have a duty of care we owe you. And if we're not working up to these ethics, we are not doing our job correctly. Yeah. And that's not what we stand for.
She was like getting so frustrated as well. She's like, just do it. And I'm like, no. Anyways, there for a while. And then she's like, so what do I do with my deposit now? Like, are you going to charge me? I said, you know what? It's actually, I refunded her deposit. And I'm like, that's fine. You can have your deposit back.
We don't normally do that, so don't get excited and try.
No, but like in situations like that where you're really, it's not even worth.
It's not. It's
like, you know, to
it's
like
a back
hold
and
that
forth.
deposit.
Yeah.
I'm like, you know what? Like, I'm not the right practitioner for you.
Yeah.
And we just have to accept that and move on.
Absolutely. Yeah.
And then she called this morning and booked to see me next week. So we'll see.
There you go. Look how amazing that is, because she's obviously gone home and reflected on the whole consultation. Obviously, she was a bit emotional because
you want something,
when
someone's
you want
telling
something,
you, no,
we're
I
humans.
get it.
We're impulsive. We want something. We want it now. But you done the most amazing thing by explaining and refute. Like, you didn't just say, I'm not the right nurse for you. Sorry, you can leave.
Yeah.
You took the time out of your day. You sat through that consultation and explained why.
Yeah.
And that's the beauty of the services we offer here.
Yeah.
When clients come in and I'm explaining to them, okay, let's look at other parts because we need to keep you balanced. We don't want to make you look silly. We explain anatomy, pulling out the face charts, the skin fat, like the fat charts and the muscle charts, and showing them all the layers of the anatomy. They're like, none of our injectors have ever explained it. And that's what separates
lions from the gazelles. Have you ever had like a situation like that where you've had to refuse treatment for someone?
Multiple. Gosh, I've been injecting for so long that I've had so many. Nothing baffles me, I think, is more than when clients come in, have had treatment before. You can see the tear trough filler sitting like jelly beans. I can see the uneven cheeks, but no, I've never had anything done.
Sorry.
But, yeah. And after a back and forth and a long consultation, like ages ago I did, but I just didn't, I
forgot. Yeah, it's gone now.
Yeah, I had someone come in yesterday to have her nose done. And on the consent form, have you had any medical surgeries? Have you had any cosmetic surgeries? And even in the consultation, she had ticked no. I'm going through the consult. Have you had any surgeries? No. I'm like, okay. Her nose looks like it was a very terrible nose surgery.
Yeah.
And I said to her, have you had any surgery on your face? No. Have you had any fillers on your face?
And you can like clearly see the scarring?
Yeah, and her nose was collapsed. So her bridge was collapsed. That's why she had come to. And I didn't want to be rude and say, but why does your nose look like that? And so it took a long conversation before she was like, oh, yeah, years ago I had nose surgery and then I broke it. And I'm like, you
do not think
skipped
to
all of that on the consent form, even in the first 15 minutes of our consultation. And then I just had to be professional, find a way around it, because obviously I have her best interest at heart.
And we don't ask these questions because we're nosy.
But I am nosy. I want to be nosy to deliver the greatest.
And cosmetic treatment history, so we can make sure we're delivering you safe and the best treatment.
That's right.
So it's very important you answer your consent form correctly.
Absolutely.
And honestly.
And with the industry, the way it's going, I think name probably a handful of nurses that I believe work very ethically. I've had conversations with nurses where they're saying things like, work smarter, not harder, get this, use this product, it's so expensive, it's cheaper, charge more, work less, see less clients, get everyone on this, and and I'm thinking, where am I living? Where have we got? How did we get here? You've been injecting so long. How are you thinking like that?
Because people aren't in it because they love it. They're in it because it's not that it's easy, but it's just like a quick way to make money for them. They have their ethics and their, what's that word? Standards are so out of whack.
Absolutely. And once you start thinking about today's dollar, not tomorrow's dollar, you're not going to make it far, and you're never going to make that tomorrow dollar.
Because people become more aware. And we live in such an aware time where there is so much information out there.
Exactly.
So people are so much more educated when it comes to these treatments, which I appreciate.
Yeah.
But
there's also a lot of misguided information. Like the TikToks. Oh. Do you know the amount of clients that have come to me recently saying, I just want to get one vial of Sculptra.
Oh.
Okay.
What do you want to do with it?
Should we talk about Sculptra?
Do you want to inject it yourself?
Yeah. So Sculptra is a biostimulator and
it's made of a polyolactic material, and it basically just stimulates collagen and elastin.
And it's not a treatment you walk out of here with the result.
Yeah.
So it's a treatment that can take up to 2 months for the collagen and elastin to start forming, and you definitely need more than one treatment.
And one vial most times.
But TikTok, I saw it on TikTok. The girl's saying you only need one. So why are you trying to sell me 3? I'm like, no. I'm the nurse.
I appreciate when people come in knowing what they want.
Yes.
But you also need to understand that you're coming to speak to a professional. And at the same time, yes, we all do the same thing, but we don't, because we all have a different ideology and we all understand things differently and we all have our own way of practicing.
Yeah.
So if you're coming to see me and you say, okay, I want this much in my cheeks and this much in my chin, you need to be open to having that conversation, because you probably don't. You probably need more. You probably need less. It's probably not what you think you need to achieve what you want. But when people aren't open to that, it makes it really difficult to have that patient professional like relationship, which is so key in these treatments.
It's so key. When I say that, I've got clients that drive from Canberra, drive from the coast, drive
from
everywhere, and it makes my heart so melt and overfilled with joy. But when they say things like, Biba, we will forever make that trek to you, because we know you genuinely care about us and it's not about making money for you. You never just get us on the bed without a thorough explanation and making sure that this is what we want. And it's never like, they don't ever feel anything is being forced.
100%.
Or
it's never.
I'm just sort of convincing them, which is a big thing now, where injectors are like convincing, oh, you should do that. You should. No. You shouldn't listen to someone who's telling you you should do this, you should do that, without explaining or why or getting into it. You're not just going to get on my bed because you've requested something. We're going to talk about it.
100%.
I'm a talker.
She is. She is.
Clearly, sitting here on a podcast because I don't talk enough in the day.
Literally.
Yeah, so that's where I'm in respect to the new TGA guidelines, because there needs to be. There needed to be stuff. Look, a lot of them are a bit crazy. Like, don't fucking tell us not to be funny. Do you know we're the funniest bitches on TikTok?
I don't even try to be funny.
In our industry, we don't even try.
It's so hard.
Like, we don't dance a lot, like, at all. No,
I don't care about the dance.
The dancing should go. You shouldn't be
I'm more of a singer.
Tidy is a singer.
I'm more of a singer.
One day, I promise you guys, I am going to make her sing for you. Heidi is a phenomenal singer. This is so off topic, but we're going to talk about it because I am Heidi's biggest fan. Okay, and I'm
never singing on the podcast.
Why?
I hung up my microphone.
She fucking did.
A long time ago.
She's got, honestly, a voice of an angel.
Stop it. I appreciate it. Maybe one day.
Yeah.
Never say never. I'll do anything once, but like.
You will.
Maybe. We'll see.
Yeah. Anyway, back to the topic. So we've got some exciting things coming up. We're going to China for the International Master Class of Aesthetic Science, biggest congress of our industry.
Amen.
We're going to fucking
Biba
learn.
and Heidi take Shanghai.
That sounded
so
sexy.
fucking excited.
I know, we're so pumped. So we are going to be bringing back the most innovative, up-to-date, safest practice to deliver.
And there's going to be so much of a focus on K-pop beauty, which is like Korean beauty.
Yeah.
And I'm so excited because every second person that walks in through the door is like, what is this happening in Korea? I want Korean glass skin. I want this. And I'm like,
I'm going
to go grab it from Korea and bring it to you.
Yeah. So this is normally it's the conference we attend in Paris.
Yeah.
So they're hosting for the first time in Shanghai for the Asian world. And you guys, we all know
with Asian beauty
and their standards and where they are. We're 25 years behind.
Amen.
So
unfortunately,
we are going to get you living in the future with us.
I'm so excited.
I know.
So we'll definitely be taking you guys, of course, along. So make sure you're following us on socials.
Yes.
But it's going to be exciting.
I know.
But when this podcast releases, I think it'll be like 3 weeks before we go.
Yeah. I know.
2 weeks. Oh my God, it's so soon.
I know. So it's going to be a quick little pop over, but that in such a short time, we're going to bring back
Amazing. A lot.
A lot.
There's nothing I love more than fighting with my sister in
Exotic cities.
locations.
So this is what
we'll
call
be
it.
arguing in Shanghai, and I can't
don't
wait.
want to argue, but
They're like fun little ones, like just so annoying, bro. And
yeah.
then keep walking, you know?
Yeah, no, but we're so excited.
And then we'll eat ramen to like make up.
Bro, I need just dumplings with the chili oil and
I'm so excited for the
to
food.
put on 2 kilos on this trip.
That's not a lot. I want to put on 5.
Yeah, I'm down.
I'm packing weight.
Yeah.
Oh, my mouth is watering thinking about the dumplings that I haven't even eaten.
I know.
Yum.
It's going to be so exciting.
It is.
Yeah.
So, yeah, we'll definitely be coming back from Shanghai with a bunch of new things for you guys.
It's going to be.
We invest so much in our learning, and I think
that's very important.
that is probably why we're really good at what we do.
I would say
Without
we're really
being too
fucking
conceited,
amazing.
But like we study so much. We travel to study, we expand, and we just learn.
We
as much
invest
as we
a
can.
lot of time and money and effort in actually staying on top of anything and everything relating
the
the
newest,
industry.
latest, innovative, safest
Practice.
techniques, technology, practices, treatments, everything.
Yeah.
So guys, stay tuned.
Yeah.
We're
exciting.
coming. Well, thank you so much for tuning into episode 2 of season 2.
Let us know what you think. Have these guidelines gone a little bit too far?
I think
Are they
have.
the perfect thing to control the industry and the madness?
It's controversial,
It
so let
is.
us know.
What you think.
Wherever you're watching this, make sure you're following or subscribed and leave us a like and comment so we can continue bringing you this content every week.
We love you guys. See you next week.
Bye.